I have a question. My upper lip is shorter in the Bell's palsy side. Is it a permanent damage in that muscle? No. In many sources, or also in medical sources, it is mentioned that the facial muscles will suffer atrophy if the innervation is not reinstated within a year. And that makes the facial palsy patients very nervous and anxious and desperate quite often, and also pushes them to go for surgical interventions. From our point of view, the atrophy of facial muscles does not happen after facial palsy, and it doesn't matter how long time has passed. And the reason for that is that the facial muscles receive sensory innervation from a different nerve. Facial nerve is only a motor nerve, so it provides signal only for the movements, and of course a little bit for the lacrimation and salivation glands. But it does not contain sensory fibers except for the taste fibers for the first 2/3 of the tongue, which probably some of you have experienced during the acute phase of facial palsy, the disruption of the normal taste, which has eventually subsided after a few weeks. The sensory innervation of the facial nerve is provided by the trigeminal nerve, which is not affected. That's why you do not lose sensitivity of your skin. You don't lose the pain sensation in your face. You may feel some numbness of your facial muscles, but it's especially in the acute phase, but that's mostly because you lack movements. So therefore, your trigeminal nerve, which senses the movements, contractions, relaxation of our muscles, lacks signals. That's why it provides the brain with certain feeling of numbness. There's not much happening in the brain. When we to the contrary, to the facial nerve, if we have a damage to the skeletal nerve, let's say the median nerve, which innervates some muscles in our palm and arm, the median nerve and all sensory nerve and all skeletal nerves of our body that provide the movement, they are mixed. They are sensory and motor both. So of course, if this nerve is damaged, then the brain does not receive any signals from the affected muscles. So neither the signals come to the muscles, nor the signals come back to the brain from the muscles. So essentially the brain, as long as the brain cannot hear anything from the muscles, it may think, okay, this muscle is dead, this soldier is dead. That makes no sense to send him ammunition, supplies, and so on and so on. So it just starts to ignore that muscle in its nutritional and trophical processes, and the muscles sustain atrophy. Atrophy, which means, so to say, malnutrition, and they shrink and they become replaced by the fibrous tissue and permanently lose their ability to function, at least partly. In our experience, the facial muscles do not suffer atrophy. So the answer to Rana, the damage to your muscle is not permanent, and I don't even think that there was a damage to your muscle. There was a damage to your nerve, and we have discussed it answering the question from another participant. Most probably there is something which can and should be done with the management system, so to say, your brain, the brain habits, and also it may also depend on the recovery level of corresponding branch of your facial nerve.